Okay, so today's lecture is going to be on gum disease, which is also known as periodontal disease. My name is Ashley Taylor. I am a registered dental hygienist. I have been a hygienist for 3 years now, and I graduated from Texas Women's University, and I have been working in a private practice ever since. I'm working on my master's degree right now. So the goal of today is for the audience, you guys, to be able to understand the stages of gum disease, know the risk factors that are associated with gum disease, and know how you can prevent it from happening to you. The objectives, at the end of this, I would like for you guys to be able to show an increase in knowledge about the gum disease, demonstrate how to floss and brush the correct way, and also be able to list 4 risk factors that can cause gum disease. Gum disease is seen in almost 50% of people, so it's important to understand, be aware of the symptoms, and know the damage that it can cause if it's left untreated. Knowing the risk factors as well as how to keep the gum disease from affecting you is important in preventing. So, like I recently stated, 1 in 2 Americans is affected by gum disease. It's seen more commonly in males. 11% of males have gum disease as opposed to 7% of females. Also, studies have shown that minorities have a higher prevalence of the disease. 17% of African Americans, 14% Mexicans, and 6% of whites have it. So what is gum disease? What happens is the bacteria that's naturally occurring in your mouth combines with food, sugar, and saliva, and it forms a layer on your teeth. It kind of feels like a film if you run your tongue along your teeth, but that is called plaque. So when plaque is not removed by brushing or flossing, it hardens and it starts to cause an infection in your gums. And as you can see in the picture here, down by the gum line, there's a white kind of layer. That's the plaque. And what happens is because it is full of bacteria, it's just a constant irritant to your gums and it makes them red and puffy. So gum disease does have different stages. The first stage is gingivitis. So what some symptoms might be in gingivitis is you have a deeper red border around your teeth. Your gums might be a little bit tender to brushing or flossing. They can be puffy and they can bleed maybe when you brush or floss or bite into an apple or a sandwich. You also may experience bad breath. And the important thing to know about gingivitis is since it is the beginning stage, it is reversible. But if gingivitis is not treated or you don't work on your hygiene habits at home, the bacteria progresses into what we call periodontitis, or the stage 2, which is advanced gum infection. Symptoms of this could be pain. You'll experience some bone loss if it progresses far enough along, which with bone loss, you can't get the bone back. And gum recession, which means the gums kind of pull away from the tooth itself, and you'll eventually lose your teeth, and you will also have bad breath along with this too. And then in this picture, you can see the white in between these 2 teeth here. That's what we call calculus, and that's just, it's hardened plaque. So it's the stuff that wasn't removed, and it hardened from the minerals in your saliva. So what's happened is that plaque is solid on there, and you can't remove it with brushing or flossing. So the gums start pulling away, and the bones start pulling away as well. So this is a picture of your healthy gums versus your unhealthy gums. On the left-hand side here, healthy gums is this pink area, and the bone is underneath it. So when the gums are healthy, don't have bacteria, the tissue is tight around the tooth, and the bone is healthy. Once the bacteria starts going down and destroying the bone and gums, that's when they become red and inflamed, and the bone starts going away. And this is a radiograph or an x-ray. The one on the left shows bone loss. So normal bone should be up here on the teeth. This person's lost several millimeters of bone, which you can see the tooth itself, the bone holds it in. But once you start losing the bone, it's there's not a lot to hold the tooth there. So when there's constant chewing and biting, the tooth can become loose. And the one on the right side, the bone is up here on the tooth, and so it provides a more stable foundation for the tooth. All right, so what's important in the prevention of gum disease is properly brushing and flossing your teeth. So brushing your teeth, the best tooth, I get asked a lot at work what the best toothbrush is. So hands down, the best toothbrush is going to be an electric toothbrush. There's several different kinds, but the electric toothbrush does the motion that you need to remove the bacteria. And they also have timers on them so you know how long you've been brushing. But the proper way is you want to make sure that you angle the toothbrush bristles up at the gum line, because that's where the plaque forms and the bacteria irritates the gums. So when you put the bristles up there, it removes the bacteria and the plaque and provides breathing for your gums. And then what's also important is you want to make sure that you get all surfaces of your teeth. So you want to start on kind of the cheek side or the front side of the tooth and go around and make sure that you do a circular vibratory stroke all around the gum line. You want to do the outside as well as the inside of the teeth and the chewing surfaces down there. You should make sure that you brush your teeth 2 minutes twice a day, every day, and that'll help prevent you from getting gum disease. And then flossing. Flossing should be done at least once a day. It's going to help reach those areas where your toothbrush bristles cannot reach. It's going to help with preventing cavities as well as keeping your gums healthy. So you want to get about 18 inches of floss. Some people like to use just their forearm kind of as a rule of thumb. And you want to wrap it around your middle fingers, because then you'll use your index finger and your thumb to maneuver around. And you want to seesaw in between each tooth. You want to make sure that you don't pop your gums, but you seesaw in very gentle, and then you curve, make a C shape around your tooth, and you want to make sure that you go below the gums. And you just move back and forth, and that mechanical movement will disrupt the bacteria that could be forming under the gums. And like I said, flossing once a day is very important. And then here in the lecture, we would pause and the audience would demonstrate how to brush and floss their teeth on the models. And the instructor would go around and help them if they needed. Okay, and risk factors for gum disease. Some risk factors are modifiable and some are not, which means some of the risk factors you can change. Some of them you can't. So, for example, smoking does cause bone loss, gum disease, and that is something you can change. You can quit smoking. If you have been diagnosed with diabetes, that's also a risk factor for having gum disease, because that just means your immune system is not at its highest potential, so it's a lot easier for the bacteria to cause damage. That's something that can't really be modified. If you're a pre-diabetic, your doctor may have you, watching what you eat so you don't have to become a diabetic. But if you already have diabetes, then that's, you can't really alter that. Controlling your stress, try not to be stressed, that can help. And then, of course, not flossing, not brushing, and not visiting the dentist regularly can increase your chances for getting gum disease. And something else that's not modifiable is genetics. Periodontal disease or gum disease is hereditary. So if your parents, grandparents have full sets of dentures, you may want to make sure that you do visit the dentist because periodontal disease can be passed down from generation to generation. So how can gum disease be prevented? Of course, brushing the right way to remove the plaque and bacteria, and twice a day for 2 minutes, and flossing once a day. Visiting your dentist regularly. A lot of people haven't visited their dentist. You want to go at least once a year, but what's recommended if you do not have gum disease is visiting twice a year. And then eliminating any modifiable risk factors that you might have. And how can you find a dentist? A lot of people like to go to people they trust. So, asking friends, family members, or neighbors, people who who they recommend for a dentist is best. And then if you want to read more about gum disease or have any questions, some websites that are good is the American Dental Association, which is www.ada.org, and also perio.org, which is done by periodontists, the periodontist community. All right, and points to remember from today, kind of the take home. Prevention and early detection of gum disease is key. Like I said, gum disease goes in phases, so if you can get it under control at the beginning, then you have better chances of not losing bone and not losing any teeth. And bacteria begins the gum disease process. There are different stages. Gingivitis is the first stage, and that is reversible. And the next stage would be advanced gum disease or periodontitis. That causes the bone loss, tooth loss, pain, and gums will pull away. Brush and floss regularly and eliminate what you can, and visit a dental office regularly. All right, and then this is where if the audience had any questions, they could ask any questions to the presenter. At the beginning, the students will have taken the pre-test, and then now they would be taking the post-test, and that's about it. All right, I wanted to thank my awesome audience and see if they had any questions. Nope.
Nope, that covered it.
That was very good. Thanks.
Good.